Greetings, greetings, greetings. I am so excited to welcome you again to another episode of Hearthside Confections NDUMODU. NDUMODU are confections of tidbits that we share with you that you can add to your repertoire and use them to guide yourselves as you move forward through this thing we call life. Now, let me say this. I believe that everybody has wisdom. So we're just sharing some of our wisdom that you can add to yours. For those of you who don't know me, I'm Okedibia Dr. Uwa Onyoha Osimere. I'm a clinical life coach, and I'm a professor, an author, and I'm a spiritual leader. I do a lot of good things, things that make me happy, things that keep me in the flow of things, as we're dealing with this terrible, terrible disease, the COVID-19, which is what our topic is today, COVID-19. But before we do all of that, let me invite you to please visit us at Chiism Live, Chiism YouTube channel, Chiism of Africa, and our website, chiism.org. Also, for this particular show, Hearthside confections@gmail.com. And if you want to contact me, 248-773-1857. I just want to talk a little bit of some little tidbits that we need to be aware of. And that is the fact that we are so excited to congratulate President Joe Biden and Kamala Harris on their inauguration 2 days ago as President and Vice President of the United States. How exciting that is. It's a new page. It's a new page. And we wish them well. And we trust that they're going to do well for the United States and also the world. There's been a dry spell there of leadership, and it seems like a new sheriff is in town, and we're excited about that. On a sad note, I want to announce, for some of you who don't know, the death of Larry King, the broadcasting giant, half a century. He's been just everybody, I'm not sure who doesn't know Larry King, but he passed away today. So we just wish the family consolation, and what have you. And I want to just welcome some people who have joined us now. Let's see. We have Charles Mokedi, Charles Ugochukwu. Ndewo, welcome. Thank you for joining us. Nosferatu, thank you. Good morning to you. And as the day goes by, I'm sure other people are going to join us. But so here we are. Now, I talked about earlier that we offer you some tidbits. So I have a tidbit today that I want to share before we get started on the show itself. Many of us have heard about the word, and we use it even ourselves personally. We use it, and that word is promise. We see somebody who we'd say, oh, this person has promise. What does it mean to have promise? The world is loaded with people with promise. People with promise are individuals who have not started making inroads towards making their promise become a reality. People who can do things if they wanted to, but people who tend to put things off and expect good things to happen. When you promise, that means right now, you're not doing what you're supposed to do. You're not what you're supposed to be, and you haven't made it yet. So when somebody says you are a promise, that means they're expecting you to do something. People who have promised are usually people who promise a lot of things and never follow through, not for themselves or for other people. So being a promise certainly is a good thing, but that means that you are yet to develop into what you're supposed to be. So to be a promise, you have to take a pen and a paper and map out a plan how you're going to make your promise become a reality. Praying is not going to make your promise become a reality. What you do, what actions you take, actionable actions, activities, that's what makes you move from just a mere promise to somebody that we can look up to. You can look up to somebody that makes a difference in the world. So just don't be a promise. Make your promise a reality. by doing something about that which you intend to become. Otherwise, you will just be like all of those people in the whole world full of promise, but promise that never materializes. So I'm going to ask you the question, what are you going to be? Are you going to be just a promise, or are you going to make a promise, your promise, a reality? Today, I have an exciting person on our show. And I am very excited because when we talk about COVID-19, and I'm sure that most of you know that there's so much misinformation about COVID-19. And what we're here to do is not necessarily to give you all the answers. What we are here to do is have a conversation about COVID-19 so that you don't have to guess what COVID-19 is. So you don't have to guess what to do or what not to do. We're going to give it to you straight because we have with us somebody today who works with people who have COVID-19. She understands what is happening with this pandemic. She's not one of those that is sending numerous paper emails all over the map. And that's the mistake a lot of us make. We listen to those things that we see on the internet. We listen to it, we view it, and we take it as truth. It is important to remember that those scientists don't have the time, real scientists don't have the time to misinform you. Their role is to tell you what you need to do about COVID-19 to spare your life, to save your life. And if you have any concerns, go to usa.gov coronavirus. Joe Biden has put it up there. Everything the United States and the World Health Organization is going to be doing about COVID-19, and particularly what they're going to be doing here. So you don't have to waste your time watching all these fake doctors telling you what to do and what not to do. Do your research. You've got a responsibility yourself to keep yourself safe. Too much on the internet about COVID-19. So here, we're going to give it to you straight. I'm going to present to you my guest today, my darling sister, Ugweze Wankwo. Gweze.
Hello.
Chinyere Wankwo,
fine.
she's a registered nurse and health administrator with Kaiser Permanente. She's one of those that we call frontline workers. So she's going to bring it to you straight. She doesn't have to mince words because we really don't have time for anybody to mince words. We want to hear the truth. So let me start. Again, welcome to our show. What does COVID-19 stand for? What is COVID-19? Because I can tell you there are too many people who don't know. What is COVID-19?
COVID-19 is, anyway, thank you first of all for welcoming me to your show. I'm so happy to be here. COVID-19 means novel coronavirus, okay, 19, which means that a co means COVID, V means co means conora, V means virus, and then D means disease. And it's a virus that was discovered, let's say, in 2019, and that's why they added that 2019 to it. Coronavirus is, it's like, let's say, it's a zoonotic, what they call a zoonotic disease. It's a virus that goes from animals to humans. And the way that you can contact it is, you know, basic humans contacted is somebody who has come in close contact with an animal who is infected with the virus. And then from the way it goes into which could be spread from human to human, and how you can move it from human to human is through droplets. You know, when you sneeze, like let's say you sneeze and you sneeze on your hands, and that droplets that you feel watery or steam on your hand is where the virus finds itself. It hangs out there. From there, it goes into the nasal cavity. From the nasal cavity, it goes into the windpipe and then into the lungs. And that's where it causes what you call an infection, which is also related as to SARS, which is serious acute respiratory syndrome.
So how do we minimize infection? What should people know to do? I mean, there's so many recommendations, you know. I mean, healthy recommendations, but from a scientific perspective, what are some of those things that we should do?
The biggest recommendation is just common. What CDC and the White House and World Health Organization has been telling to people to do. Wear your mask, very simple. Social distancing, you know, wash your hands, you know, stay 6 foot apart from people, you know, because the reason why basically they say stay 6 feet apart from people, because it takes a lot of droplets to get you infected or a positive infection. So those are basically the simple things. When you're blowing your nose, you cover your mouth, and whatever tissue that you use, you just you toss it, wash your hands. So those are basically the simple things that CDC recommends that seem to be a very, very difficult thing sometimes for people to do. So it's not rocket science. That's basically
why is that? Why do you think people have such difficulty following such a basic recommendation? Okay, she's frozen. Can you hear me? Okay, we're having a little technical difficulty. And you know, as you watch television, you see a lot of scenarios where people are fighting over the fact that they have to wear their mask. So I was just trying to explain why people are fighting over wearing masks. You see it at the malls, you see it at the stores when they are being told, just put your mask on. You know, it's almost like Joe Biden said, it is your civic duty. You know, it's us protecting each other. You know, you don't have to do it, but if you don't, we'll never get out of this. You know, so a lot of people say, oh my God, you know, my.
Can you hear me now?
Okay. Yes, I can. Go ahead.
Yeah, well, I can't really understand. I know that people are very frustrated because of the stay-at-home order. You can remember at the beginning, people are heeding to the recommendations. You know, this is a very new virus. I know it's an offshoot of SARS-1, but it's a very new virus.
Okay, here again, we're having a low technical difficulty. She'll join us shortly. You keep going in and out.
Okay, am I in now?
Yeah, yes, you are. Yes, you are. Go ahead.
I don't understand why that's happening.
That's okay.
So, you know, people have been frustrated, and at first they were heeding to the distancing and all that. But another thing, it was made political. They understand it was made political. Yes. So that's what exacerbated the problem that we have for people now heeding to the instructions. So it's just a simple thing, you know, because once you get coronavirus, you're infected. You can understand that you have family members that live with you. So it's not like when you get coronavirus, it's just you that gets that coronavirus. Your whole family members also have the susceptible to this virus. So, and all the misinformation also, because of this political and leadership all the misinformation started, circulating, and then it became a problem having to people to heed to the simple instructions to prevent them getting infected.
Besides washing hands, okay, wearing your mask, social distancing, what are some other things that we can do, people should be considering to keep them safe, or at least minimize their susceptibility to COVID-19?
Well, other ways that you can strengthen your immune system. That's the main important thing, strengthening the immune system. Strengthen your immune system by drinking vitamins, but you need to talk to your doctor so that you know exactly what kind of vitamins that you need to take.
Are you still there? Keep freezing.
Yeah,
Okay,
I'm
we're
still
having a
here.
little technical difficulty. Okay, so what happens is it's not enough to wear masks. It's not enough just to wash your hands. This is not a time to gain weight. Am I right?
Yeah,
This is a
that's
time
right.
to really, really monitor your health. Eat properly, lots of vegetables. Go ahead, please. Go ahead.
Another reason why those are the ways to become, less susceptible. The most important thing is wear your mask, wash your hands, do not touch your face and your mouth and your nose. Do you understand? And then, clean the countertops because, people come in, the doorknobs and all that, they touch it. And if they go outside and come in, they might have a virus, maybe that's, patched on the doorknobs. So keeping your surfaces and your surroundings clean. And then if you're going to take vitamins, strengthening your immune system, you call your doctor and get what the, things like probiotics, making sure that you're eating healthy, exercising and doing yoga, to clear your mind. Sometimes when you have what you call mental, let's say things like anxiety and all that can also break down your immune system, so those are the kind of ways. And another reason why America has had a lot of problems with health, population with health issues. And racism is another way that, racism also has a very big part to play in the rate of infection due to a lot of Americans who are not able to afford, uneven health care. They develop underlying conditions. So that is why sometimes America is also having this big problem, because a lot of the people that are admitted in ED, a lot of them have underlying issues. The ones, with weak immune system, heart disease, diabetes, let's say kidney disease. So those are people that are susceptible to the let's say to the degree of hospitalization.
Well, I can see where if individuals don't have the financial means, to buy vitamins. Have you priced the cost of vitamins? When you can't even put food on the table, poverty really plays a role.
Poverty,
you don't,
yes.
you don't have enough food to eat. You don't even have the basics, let alone
fresh food. That's right. Fresh food in some neighborhoods are almost like zero. In poor and communities of color, they don't have access to fresh vegetables. They eat a lot of canned foods, which contains a lot of sodium and sugar. So those are the things that contribute to the immense underlying condition and lack of access to healthcare.
Yeah, but let me ask you. There's somebody, Obi Onyoha, the famous Obi Onyoha, as you all know, Queen of Soul of Nigeria, and my darling sister, might I add. our darling sister, we're all sisters here, she asked this question, and that's a very important question. There are individuals who have contracted the virus even after taking precautions. What do you say to such people? She says that she knows people. I do too. What?
Sometimes we really don't know how people contact, because majority of the patients that we get, when you ask them, how did you get it? They can't tell you. I know nurses, I can tell you how a nurse or doctor gets it, because you're in contact 24 hours, like 12 hours a day with a person with active COVID virus, COVID.
Yes.
So, but a lot of time we can't even, and I don't think any science other than what they tell you, the precautions, and those are the basic way that they know that you get it. We can also explain how somebody who has done everything, they understand, end up contacting the virus. So that's why they say, if you don't have anywhere to avoid crowds, a lot of times you go to the store, the grocery store, back and forth and all that, go to restaurants and all that. And that's probably how people get it. You know, you do your daily activity in crowds or whatever, and that's possibly. So I cannot really tell you, because we definitely do not know. Can you hear me? Maybe I'm just...
Okay, you're okay. Now, so I have a question. What is the treatment? Okay. What available treatments are there for COVID-19?
There's actually the only treatment that the FDA has approved for emergency approval is what they call remdesivir. That's the only for people with active COVID. But then we have the Moderna and Pfizer, and I believe that they're still Moderna and Pfizer, and I believe that Johnson & Johnson is about to come out with its own vaccine, which is a one dose vaccine instead of the 2 dose of Moderna and Pfizer. But there's no remember, those vaccines are emergency approval. So it's not like we say, okay, they did their testing and they found out that this vaccine, the virus is sensitive to, let's say 94% sensitive to Moderna, and then 95% sensitive to Pfizer. And then they say, okay, in order to stop the spread of the vaccine, we need to now use it as emergency authorization. Not that it says, oh, it's the full treatment. No. Emergency authorization used in order to get at least 70% or 75 to 80% of the public vaccinated so that they can create a herd immunity. So the vaccines are for prevention. They're not for treatment.
So even after you get the vaccine, if you get the vaccine, you can still contract coronavirus, but it prevents you from getting sick. Is that correct?
Yeah. After you get the vaccine, there are you get 2 doses. The first dose gives you, they call it the primer. The first dose is called the primer. It gives you about 50%. What it does is it activates your immune system. The primer prepare your antibodies. And then which it takes about 20, for Pfizer is 21 days for the primer to activate your antibodies. And then the second dose is called the booster. So it's like the booster, the virus sees, okay, I've seen it sees the replica, and then he attacks it. So when you get when you get to a full 94%, let's say for Moderna, you can still contract the virus, but it will protect you from the infection. But you yourself can still test positive for the infection and then can give it to your family member. But for you, it will not do anything to you, but your family member who has not received the vaccine can still get infected and fall sick, seriously sick. So that's why when you get it, they still tell you to wear your mask, social distancing, so that you do not get infected and you infect others.
So you're protected by the vaccine, okay? You yourself. What is it? Only if after you've gotten the 2 doses, or is it just the one?
The first dose give you, which is a primer, give you about 50. I think Pfizer, Moderna might be a little bit more protection on the first dose, but Pfizer gives you about 52% protection. If you get it, and then it takes about, let's say, 21 days for you to build that, 52%, like 3 weeks. And then they want you to now take another one. And you get the first dose, you can still actively get infected and get sick. That's why there's 2 doses. After the second dose, you might not get sick. But remember, it is only 94% coverage. It's also like the flu shot. The flu shot is about maybe 60 or 70% coverage. That's why you still hear that people die of the flu. So it's still up for, let's say for Pfizer, it gives you 95% coverage. But there's still a population that might still get that and still get sick, get infected. Do you understand?
Mm-hmm.
So
is it?
So that's why they want the herd immunity. That's why they want the herd immunity. So the likelihood of infection rate reduces.
But you know, I said it earlier, and that is there's so much in the internet right now. I'm not an advocate for anything. I just want the truth. You know what they say, just the facts, please.
Yeah.
You know what I'm saying? You know, I'm not a doctor, so I'm not in the position to tell anyone don't take it or take it. That's why I want people in the field, the experts, to tell us what are our options, and most importantly, go to the CDC. Go to the CDC and find out. There are so many QAnon or whatever they call these people who they're dressed in their white coats and they say, I'm doctor this, I'm doctor that. And they say, oh, don't take the vaccine. Well, is the vaccine dangerous as they talk about? I have some individuals who think that the vaccine was a cover, or at least COVID was a cover for 5G, that they got phones, okay? And their chips in the vaccine. Is this true? Now, I'm just asking. These are some of the things out there. You know? Oh, and they're trying to kill Black folks. Come on, talk now.
The funny thing about it is that the people that are spreading the fake and the fake news and all that about these vaccines are the people that have gotten it. They've already gotten their vaccine. Yesterday, I was hearing and I was watching CNN, and it showed that the QAnon and the people, like, let's say West Virginia is the QAnon capital of United States. And almost every that voted 99% for Joe Biden, for Trump, let's say 80 or 90% for Trump, they've all gotten their vaccines. Mm-hmm. But they are the ones spreading, do not take it. It's going to hurt you. I got one from somebody yesterday that showed this woman, acting like, oh, she said she got the Moderna vaccine. And then she showed us that she was convulsing and all that. Since then, it's been making her dance and all that, blah, blah, blah. And somebody that is pretty intelligent sent that thing to me. She got that stuff and send it to me and tell me, oh my God, this is what they say the Moderna does. But you'll be shocked that that woman that was doing this, that has already gotten her vaccine. And Africa seems to be the #1 spreaders. They send all these things to Africa and maybe to this false information, feeding Africans, because a lot of those false information, they feed it to them, and then Africans on Facebook and WhatsApp send it back to us, what they are being fed. The vaccine is very safe. I have gotten mine. And I can tell you at Kaiser, we just finished everybody's second dose yesterday. So now they're going to move now into members of Kaiser, the population who are members, and then to those who are non-members. I have taken it.
Yes, well, thank you. I've got to say this. We were so grateful to see you showing that you're taking it, that you're not just talking stuff. Again, I am not here to advocate take it or not take it. I always say, when you say don't take the vaccine, I would ask you, what is the alternative? Because masks alone, washing your hands, social distance is not going to do it. And eating healthy and all of that, it's all part of protection, but it's not the cure. You can still contract it. So what's going to keep us from dying thus far is the vaccine. For those who don't believe it, go and do your research. Don't buy into what people are telling you. You have a mind, use it. That's what I say. If you don't want something, don't be the arbiter of bad news. Bad news in terms of telling people don't do because you don't want to. Well, okay, that's your, that's your sense. That's your feeling. Don't do it. But teach others. Go and find out for yourself. See what's going on. If all these people are fighting, could you please, because I had a conversation with you, tell people what happened when individuals could not get the shot.
Oh, yeah. That was about 2 weeks ago, because the Pfizer vaccine expires quicker than the Moderna. So when it's time for it to expire, because we don't want anything wasted, we try to find individuals that came from doctor's appointments or whatever in the hospital if they want to take it, especially people 65 years of older. And when we announced, because it was almost time for close time, when we announced, announced that anybody who's 65 years or older, or anybody here for doctor's appointment, if you want a vaccine, COVID vaccine, you can come up to room 301 and get your vaccine. So a lot of people, it wasn't according to the category. A lot of them were not even in the category to receive the vaccine right now. It was like a multitude, like when they say Sermon on the Mount, when Jesus was about to feed the masses with 300 loaves of, how many loaves of bread? People were crying. People were rushing. They wanted to touch my clothing just because I was about to give them a shot. Mind you, people, even though there's all this fake news about the dangers of, people questioning the efficacy and the safety of the vaccine, it's just a minority. From what we are seeing, and we are really encouraged, is the amount of demand, people who will do anything to get it. Sometimes they tell you, oh my God, it seems like I won the lottery. That is better than winning the lottery. So people really want it. But since it's political, a small number of people try to discourage it. Maybe some people based on religion, or some people based on their political affiliation are discouraging people. So that's why it's good for you to do your research. Yes. When I did that's why. And a lot of nurses, when they take it,
Okay, she's freezing again. And until she comes back, I just want to focus on one thing.
And we
Okay, there you
encourage
go again.
others to do their research. Yes, do their research and take it. There are side effects, yes. And those are the side effects that is already noted that there are side effects to this. Like any medication that is advertised or brought out, there's always side effects.
Even
So
Tylenol.
you have to, sorry?
Even med Tylenol.
Any medication, it's like pick your poison. That's where we're going here. Pick your poison. You need to take the what do you call it, the vaccine, the side effects to every medication, and they let you know. And we just don't give you the shot and tell you to go home. No, we have to monitor you. As soon as we go over, you have to be there 20 dependent. And then there's a list of all the side effects you've experienced. If you experience any side effects to vaccines or anything, we have to monitor you right away, just in case there's a problem. There's immediate emergency response to it. Yeah. And because of that, we haven't had any serious, for Kaiser and all the people, all the hospitals, we haven't had any, just a few, any serious side adverse effect to the vaccines.
Okay, let me. I just want to read what Obionyoha has a question. A friend in Nigeria has just recovered from COVID-19. He explains how he got cured. Now he's saying that he was cured. He took Zetromax, an antibiotic, oxychloroquine, vitamin C, zinc, and inhalation of steam 3 times a day. What do you think?
Well, I don't know whether Zetromax and hydrochloroquine helped, because there is no study that shows they've all the testings I've done that hydrochloroquine is effective. And another thing, Zetromax is an antibiotic. It only works with bacteria. Yeah, there's no antibiotics that works with virus. Virus is an inanimate object. There's no virus. Viruses are basic. What do you call it? There's no antibacterial.
Okay, sure.
Zetromax. You know.
I think we missed a little bit there. You kind of froze. We missed it a little bit there. Okay.
Huh?
Okay. The question that Obi asked, we didn't quite get all of it. We didn't quite get all your response in terms of what the individual took, because you kind of froze.
Okay.
Can you repeat your answer there?
Okay. Can you? Am I unfrozen now?
You're unfrozen. Yes.
Okay. I don't know what Zetromax is an antibiotic. It only works with bacterial organisms. It cannot work with virus. Virus is an inanimate object. It doesn't have a nucleus. Do you understand? So, so that I cannot, you know, I might discount that one a little bit. So that cannot cure a virus unless it has something else that is bacterial. Hydrochloroquine, some testing has been done, and he has no effect on virus, on the virus or the treatment of COVID-19. The zinc is only good. It's not a treatment or a cure. Zinc is a good one to fortify your immune system, and vitamin C. I don't know about steam. So people do recover. Don't get me wrong. People,
Okay. All right. Now the technical difficulties here, but I want to read what Obi. There's you froze there again. It's okay, people. You know technology will do what technology will do. So we'll just work through it.
But did you get a little bit of what I said?
Yeah, I think we pretty much got that. But another statement by Obi. She says, I'm glad about this discussion, and my husband who is a non-believer, is listening. He says he'll wait until he was sure people were not growing horns or breaking out with mad cow disease. Oh, hell. You talk to my husband, please.
I haven't seen. We started giving this vaccine for a while. I haven't seen people. Maybe it takes a long time before you develop
Before the
mad
horns come
disease.
out.
Yeah, I know. And mad cow disease is like is it a protein? Is it prion or whatever? I don't know if it's a bacteria or whatever. But I haven't seen anybody develop mad cow. I haven't yet. I just got my second, what do you call it? And I know some people are afraid. Yeah, they're afraid because they watched the movie I Am Legend.
I Am Legend, yes. But I've, in all actuality, it's important to know that particularly people of color, and they are the ones who are most impacted right now. A lot of them are scared because of historical facts. Okay, historical facts. And so based on that, a lot of them don't want to take it. And there are people who are so anti-vaccination. You can't force people. I mean, it's their prerogative. But I think that we should be looking at this just from an individual perspective. We also have to look at, do we want to get back to our lives? Are those numbers that are dying in the hospital, the 400,000 here, the 200,000 there, are they fake? Are they real? How do we get back to our lives if we're not willing to do what it will take? Okay, if you don't want to take vaccines, do not run around telling people don't take vaccine. Instead, advise them, go and read about it, check it out. Hey, as a matter of fact, talk to your doctor. These doctors are willing. I talked to my physician, and I was just absolutely not going to do it. Now, I'll be honest with you. I told, just like Bobby's husband, who thinks that people grow horns and stuff. I was wondering from where my horns would come. I was petrified. But I'll tell you the truth. I was petrified because of everything I'm reading. Initially, I was like, this person says, oh, you don't, they're going to put chips so they can track you. And then when you get to be a certain age, they can pull the plug and you'll die. That's, what is that? What's his name? Foundation. Bill Gates is into vaccinations. He's going to make a lot of money out of this. And he's involved in population destabilization or reduction, or all that sort of thing. So all of that is out there. So you've got people scared to death. No, I don't want to be, I don't want to take it. My thing is, before you say no to something that will save your life, you need to see who's taking it. Yes, I know what the past has done to us, but you better check the people who are taking this thing. And by the time it gets to you, there's no more left. Right. So before you say, you know what I'm saying? They are taking it all over the world. Okay? Before you say no, before it gets to us, there's no more left. Then that we will be begging, help us, help us. It's too late because we've been convinced not to participate. So I'm not saying to participate without educating yourself. Participate, but make sure you're not one that tells people don't do. Find out first. Talk to your doctor. I talked to mine, and she told me, I've taken it. My husband has taken it, because both of them are physicians. She says, it's safe for you to take. Now you're here asking me to prescribe medication for your aches and pains and all that good stuff, but it has side effects as well. So the side effects should not dissuade you, and you are not going to have any chips in your body. No, I'm not going to do that. It's not a cover for 5G and all that sort of thing. But anyway, I have another question I want to ask you. What you indicated that there are some side effects. What are the most common side effects that you know of? You can share.
Well, the most common side effects from the vaccine is that most people complain about. Number one is pain on the insertion site, which is where you get the shot. You do get a lot of pain, maybe like other, vaccination shots. Muscle pain. There's a lot of muscle pain. There's muscle pain. There's joint pain. There's a feeling of headaches. You get headaches, fever, chills, malaise. Those are the side effects. But it's like probably just like you have the general feeling of I'm sick, but it's not the virus in your system. They do not use the virus. It's a replica, I believe, of one of the, let's say, a component or something like that. But it is not the virus in your system. So those are the side effects. And it's generally like about 1 day. And then, you feel better. 1 or 2 days, you feel better. So that's why usually in the hospital, they tell you, no, you're not getting it on a weekday. You're going to get it on Friday. Because you won't get sick. But it depends on individuals too. There are people who get it and have absolutely no side effects. I got mine, and yesterday, yes, I had severe pain on my arm, and just from the incision site, the needle incision site. And I had a general feeling of malaise. And then this morning, I'm talking to you. So it's just the general side effects that you get. But because this is a virus people are not 100% sure of, they're still learning. After you get the shot, CDC will follow you. And they just want to know what your side effects are so that they can include it. So the ones that they're talking about, like the pain and all that, are the ones that people say, yes, this is what I'm having. And it's generally almost the same thing. And trust me, America does not want to kill off all their doctors and nurses, all our doctors and nurses and the first responders to be the first to get it, So to me, it's generally, it's a safe vaccine that I will recommend anybody to get for your loved ones. I work. The reason why I say is I work. Our office, now I've worked in Duet, what they call Duet. I worked in the department that the testing and the recommendation for admissions. I worked there. I also did ED, which is emergency department, where I've seen the COVID patients and how bad it is, how sick human beings can get with
Can you please describe what you see? Because I'll be honest with you, there are individuals who don't believe that the numbers are real. They don't believe it.
It's unbelievable. You are completely isolated and you are put like in a casing, a glass casing, but it's just like a unit in the ED and covered in order to prevent infection. You walk in there, you feel like you're in Mars, and people are really sick. A lot of them unconscious. A lot of them is like difficult when you're watching a human being gasping for air. And then there's not enough equipment to help those people because it's everywhere. In Kaiser, you have people with active COVID lined up on the hallway because there's no place to put them. What do you call it? In most hospitals, let's say Martin Luther King Hospital, they're now using their,
church,
like coffee shop, the church. And they are where they buy, what do you call it? What is that? Anyway, every aspect of Martin Luther King has become a COVID unit. So for people to say it's not real, I don't know what it is that they're seeing. There are 419 or 400 and how many thousand people have died. And some people are still in denial. It doesn't make sense. We see this every day, and it's very disheartening for the nurses and doctors. That's why a lot of them have given up, and California's problem is not because management or administration of the hospital is not trying, or have done everything. It has become so political now, they're trying to use it against the doctor, even though whatever the governor calls for is being requested by the doctors and nurses. Please, we can't handle this. The mental health of nurses and doctors is unbelievable. It's total devastation.
You know, I was watching I watched a nurse who had been so overwhelmed by the whole thing. She went in the corner and curled up and just sobbed. And when they asked her why she was sobbing, she says it's not so much just because of her being overwhelmed, but the humanity, the enormity of seeing people dying, and these very people are warned what not to do, but they do it anyway. And
do you know that while right now I'm in the vaccine department, right now every minute every time I'm at work, every 30 minutes, you're hearing code blue, ICU, code blue, care, intensive care, code blue. That's all we hear. And majority of them are COVID patients. It's every day. It's like, we don't know how else to explain it to people. The ED has tried to open up in some states, like in Texas, for people to see what is going on in there. So sometimes the overwhelm is people's response to this virus. It's like, no matter what you tell them, because they're in their political square or whatever, they're not getting it. You know, we've been so desensitized that they're not getting it. Well, so now we're losing doctors. I work in this thing. Majority people I come in contact with on a daily basis, nurses and doctors, already have COVID.
They have it and they're quitting
with them every day.
And they're quitting. They're quitting. And then when all these people quit, what are we going to do? That's why disinformation is not good. I tell people it's not a matter of how you feel. You are not a doctor. It's not, and I'm going to repeat this today. It is not about how you feel, what your sentiments are. It is about making sure that you're not part of the problem. The problem is huge. We have got to develop herd immunity. And you're not helping. Telling your family members, don't believe it. You know, the other day, I was at Walmart. Shouldn't have been there, but I was. And Walmart says you have to wear a mask. And there's some people who are in there just arguing and fighting because they were told to put the mask on. It's just, for some men, it's not cool. For some women, you got to see their lipstick. It covers their face. This is a serious thing. And quite frankly, that's why I'm so grateful you're here. Because I've heard from all kinds of people. But I wanted to hear from somebody in the front line. And I am just so blessed that my own sister is in that front line. It's one of those heroes and sheroes that we're talking about, seriously. Now there's something else. People don't know that you can overdo it with wiping your hands with sanitizers, okay? Because you can get exposed to methanol and propanol. You can be contaminated, okay? And so it's very, very important that you don't overdo it. And if you notice when you're reacting to those things. Am I correct? Notice when you're reacting, and you should throw them. You should stop immediately, dispose of what you have, but don't dispose it in the sink, because we tend to do that. We got pour in the sink. Don't do that, because the sink, that water goes into a public, sewer. So you don't want to do that. Put it in as a matter of fact, if you don't have it right now in your home, have a contaminant box, right? Something you put things that are contaminants in that you can close, you know, and if you throw it away, it is in a container that will not be exposed, you know. So be careful if you're using those things, and don't spray it on yourself. You know, people think, you know, let's spray it on ourselves, but that could be dangerous. You were saying something about that. Talk about that. Why it's kind of dangerous to spray all that?
Because it could cause you another respiratory infection, a respiratory not infection, but respiratory complication. Because when you're spraying it on yourself, you're inhaling the what do you call it? You're inhaling, like, is it methanol? So it could damage your organs. So you cannot spray it. You can have skin irritations from it, and it can be damaging to your eye. You can, you know, have it in your eye. So that is not a good idea. Nobody has ever recommended spraying sanitizers or disinfectants on yourself. You can't do that. You can spray it on your surfaces, which is your tables and chairs, and where the hands, you know, you touch your hands all the time. But spraying it on yourself is very dangerous. You don't do that. It's like telling somebody drink a Clorox or whatever.
Clorox. Okay, so I have another question here. Are medical staff selective about who they treat? There's been stories circulating to this effect. Could you please disprove this? This is Obi on your hand.
I cannot say that I can disprove this, you know, because we've heard informations like the doctor who asks for, especially African Americans, that they complain that they're not getting equal treatment. It's always been like that in the United States with everything. When they say infant mortality, Black women are more, even with any kind of class, are more die more than even, you know, a lower class white person with less education. So it's the same way here. African Americans and people of color, yes, they are facing some kind of discrimination in the hospital. But another thing is that, you know, that's why they are saying that, you know, let's say Biden is talking about equality, trying to promote equality or whatever in the healthcare system. So I can't really say, I've heard, but I can't really say that I'll be able to disprove it. You know, so I cannot disprove that. There is, as we have heard, I haven't experienced it, you know, and at Kaiser, I haven't seen that happening in Kaiser, you know. But another thing you need to understand is sometimes the frustration in nurses and doctors, you know, sometimes get people to be, you know, frustration, and, you know, get the nurses and doctors to just, you know, do the work, forget emotions and all that. And, you know, you might not get that person to person, you know, treatment or care. So, but I would not, I cannot say I disprove that, you know, because I have heard from the doctors and whatever that got sick and they did not get equal treatment.
Yes, I saw a lady who said that. Now, we have we're talking about Texas. Nons Ferrato has just indicated that Texas is threatening to stop giving vaccines to Dallas because they want to vaccinate those in low-income areas. Can you imagine what does that mean? Why would they stop? Because low-income people are being vaccinated. I mean, are we not all supposed to, if you're going to get herd immunity, are you not supposed to vaccinate everyone? Are you going to select based on who's poor and who's not? That doesn't make sense to me. Does it to you?
I don't. They're stopping in Dallas to others to give people of low income.
Well, no, because they say because they want to vaccinate, because Dallas wants to vaccinate those in low income areas. So Texas is threatening to stop giving vaccines to Dallas. That doesn't make sense. I mean, I don't understand. Well, this is just something she just shared. That sounds ridiculous to me. quite frankly.
I just heard it right now. I haven't looked into that. I'm not sure. You know,
Okay.
it is based on the availability.
Okay. So now we okay. She's frozen again. Um.
So I
Okay.
still need to look into that. I haven't.
Okay. Yeah, share that, and then you can go to our Facebook page and just kind of type, give us a little information about what you find out. Now the other thing is, I think you talked about the disinfectant. No, you're not going to stop COVID by spraying people with disinfectant, right? You know, we're not going to do that.
Number one,
Okay.
the person can
Now,
sue
yeah,
you.
now somebody asked me this very interesting question: do you spread COVID-19 through intercourse? Before we go any further, I just want people to know that I just added an extra 15 minutes to our show so that some of these questions can be answered before we end the show. So can you answer that? Because somebody actually did contact me to ask that question.
Well, not the thing about it is, COVID is a respiratory infection, and close contact is the means of spreading the virus. So I could say yes, not based on the intercourse, because it's not known, even though some men that have had a COVID has been they found what do you call it, the virus in their semen, but that's not the way, that's not the channel of infection. The channel of infection is respiratory droplets. So face-to-face contact, kissing and all that, you could, you're susceptible to catch the virus like that, you know, because you're face-to-face contact, you're breathing, you know, each other breathing in you're breathing in each other's face, and you know, you're kissing or whatever. Yes, you can get it through that way, but not through blood, semen and all that. No.
Okay, so if you're going to engage in sexual activity, please be sure to cover your mouth, your nose. Don't even breathe on him or her. Just stop. Just kidding. You know, people
No,
do what they have to do. You know what I'm
remember,
saying?
it could be on your clothes. It could be
Huh?
on your clothes.
It
It
could be
could
on
be
the
on your
clothing.
clothes. It could be on your body.
Yeah,
So
it's terrible, but you know,
it's a
so
terrible
that's why
virus.
it's very, very important. I mean, for us to get back to our lives, it becomes imperative that we consider all the measures that are being implemented. And if you find that you're not comfortable with it, then don't be a part of it. Don't do it. But don't tell people not to. And don't base your argument on assumptions, because that's exactly what we do. We assume. Somebody said, oh, you know, this is where I get all this stuff. Somebody said this, somebody said that, you know. And everybody's concerned. I mean, the concern is real. You know, I think that for the African American communities, Black world in totality, you know, we're very, very concerned, particularly if we're not the ones producing it. But it is important for us to know that it was a Black woman. Am I right? You know, she is the one that was heavily engaged in this. So I'm not so sure she wants to kill off Black folks. You know,
And a black man who's for Pfizer, the black Nigerian doctor who's in charge of the testing and distribution. I'm sure he has seen all the, you know, all the components of this vaccine and recommends it heavily, you know, and we should all think about that. We do understand that African Americans have had experience during the syphilis. I'm not sure how that, you know, occurred, and so I cannot speak to that. But they, you know, say they should do their research and not take all these false informations as facts, because they're not. And if you can remember, the look at it this way: every pandemic has affected people of color and Africans. After the pandemic, has been controlled. It happened with HIV. It happened with H1N1. It happened with what you call it, the Spanish flu. Africans always, their pandemic starts after the pandemic has been controlled in other countries, because the denial and the falsification of information, you know, superstitious beliefs, believing Africans cannot get it. It's a white man's disease. It's like the one in Nigeria. It's a rich man's disease. It's the European disease. Then after we control it in the United States, who is now the pandemic will then begin more in Africa, and people will start dying.
Now, what about South Africa? I understand that, you know, right now there are lots of mutations. You know, the virus is mutating. So you have different kinds of virus now. And in South Africa, it's getting kind of out of hand.
Yeah.
You know, how should we worry about the new variant? How the and children.
Right
children.
Right.
Let me just add this: children that indicating that the new COVID variant, the children are catching that the most. Why is that though? Why is that? Why is it impacting children?
No, the virus has been allowed to fester into the community for so long. There's no treatment for it. So they replicate and mutate into different forms that becomes more dangerous. And now, at first they said, okay, it's more widespread. It causes more widespread. But now it is more, it can increase more death rate. That's the new one that is coming from England. Before they say it was just infection rate, but does not increase the death rate, right? But now they think it can now increase infection rate and more death rate. So right now they're doing testing with Pfizer and Moderna, because the new variant, the first variant and the new one from UK, they show that, which is B117. They show that Pfizer and Moderna, the vaccine right now, is able to protect you from that.
Okay.
But the new variants, there's so many of them. There's been like 4 variants now. This last year is not the, what do you call it, last variant. Now it is, they're getting more variants, which are more dangerous. So now Moderna and National Institute of Health and Pfizer are now doing, what do you call it, the testing to see if it will protect you from that. So that's why now there's a rush. That's why the president just signed that emergency declaration, or emergency, I forgot what they call it. You know, it's a rush, mad rush now to get it to 75% of the population, so that they can to stop the virus on its track, so that it's
before it mutates.
That's right.
Even
more.
Before
mutation. That's right. So
you know, I want to add something, just a little public interest story that people should know. It's not interest story really. It's information that everybody should be aware of, something that's going on in our foods. Ladies and gentlemen, the foods are getting contaminated. If you eat, let me make sure I put this on the screen. Frito-Lay has just issued a voluntary recall of their Ruffles original potato chips, okay, on January 21st, because they may be contaminated with, they may contain contaminated undeclared milk ingredients. Okay, so the bags in question are the 13.5 ounces party size variety. So if you got that in your home right now, go and check it and do not eat it. Okay, that's one. And then the other food warning that they just put out is regarding the Highland. There is low-fat chocolate milk. The recall applies to the 1/2 pint cartons of the 1% low-fat chocolate milk. So it's going into our foods. This is scary stuff. So we can now contract the thing from our food.
That's
So
right.
if you should go to the FDA website and see all the recalls. Please do that. That's important. And that's really what this is about, to give you some information, but then the bulk of the work has to come from you.
That's right.
You know what? I am so grateful to you for being on this show. But what is your closing remarks for
My closing
our
remark
viewers?
is, like you said, the hospital cannot do it alone. The hospital is where you come for treatment.
Mhm.
Okay? The government can't do it alone. If the government and the hospitals are trying and the people refuse, there's no way we can get this virus in control. This is a very dangerous virus that mutates. And the more it mutates, it gets worse. And everybody wants to go back to their normal life, but they don't want to work or do what it takes to go back to the normal life. It's like we're waiting for the government to come and wipe it away from us without us doing anything to help. You need to learn about this coronavirus. I want everybody to read about coronavirus, what it's made of, and read about this. Right now, there's no active, let's say, treatment. We have a preventive measure. The remdesivir works for some people, not for everybody. They have a cocktail, they say remdesivir cocktail. It doesn't work for everybody. And it has not been produced en masse, and it's not FDA approved. It's just for emergency treatment. So read about the coronavirus and the vaccine, because we really, really want to attain, a herd immunity. And that's the only way we can go back to a life. I don't know if we're not miserable enough. All of us claim that we're miserable. We want to go out. We want to see our friends. Our children are suffering from severe mental issues. So we need the public help. We need everybody to learn about this. Reach out to your friends, your brothers and sisters. Talk to them. That's the only way we can get this done. Listen to the White House, the CDC, the World Health Organization. The president called for a mandatory mask just for 3 months. It's been like 1 year we've been suffering this. All he's asking is for 3 months so that he can get this virus under control and economy come back. People are suffering, people are starving, people are losing their jobs. Only us can get this thing under control. We can do it. Nurses can do it. Doctors can do it. The president can do it, unless we decide ourselves as the public to help us and the government control this virus and eradicate it.
Eradicate it. Thank you so very much. We are so grateful for you taking, I know you work long hours, but you took the time to go as a Chinyere Ezeala. We are so happy. Registered nurse and health administrator, for those of you who are just joining us, Kaiser Permanente. Thank you for your time. Thank you for your wise words. You can't force, you can take people you can take a horse to water, but you can't force it to drink. It is really, truly up to us to make this pandemic go away so we can go back to our lives. But we must be cognizant that it isn't what someone else's research tells you, it's what your research tells you. So take the time, go to the CDC, talk to a doctor, talk to a nurse, talk to the people in the front line. They're all there. Matter of fact, they're waiting to hear from you. My daughter is in the front line, Kelena. She's at work right now, and she tells me that every time that she looks, she works in the lab, all these numbers of COVID infections. So they know this thing is real. Nobody's trying to lie to us about this COVID thing. It is up to us to make it better. Please, for the children, for everybody, every child that wants to go to school, please, find out what role you can play. Can you participate by taking the vaccine? If not, what do you have to do? Because there is no cure. There is no cure. So it's not enough to tell people don't do, but you have nothing else to offer. Whatever it is you can do it. So I want to thank you, Ugo. Thank you so very much, Ugo Eze. Thank you for all our listeners. Udemezu Onyoha, Nosferatu, Onyoha, Matthew Lewis, Obi Onyoha. Let's see, we got my family say, hey, my family represented today. We got in here because we know what we have to do. We have let's see who else is Charles Mukedi Ugochukwu, Global Faith Ministries of Chiism, and so on and so forth. Thank you all for being here. And let us go and make a change. Let us go and be the face of the change. Let's get rid of this monster. I want to see my family. I want to go visit. I'm sick and tired of these four walls. And I'm sure you are as well. Ladies and gentlemen, it's been a pleasure. And I look forward to seeing you next Saturday, same time on Hearthside Confections. See you then on Saturday. Bye-bye. Thank you, Ugo.